on Health in the Americas, Accelerating Disease Elimination. We have simultaneous interpretation services in English, Spanish, and Portuguese. And during the webinar, you will have the opportunity to post your questions on the Q&A box. So we invite all of you to do that throughout this webinar. Today, we are honored to have distinguished delegates from Brazil, Colombia, Panama, and St. Vincent and the Grenadines, as well as from the Pan American Health Organization and the Task Force for Global Health. With this, I now welcome Dr. Jarbas Barbosa, Director of the Pan American Health Organization, to give us the opening remarks for this webinar. Dr. Barbosa, welcome.
Thank you, Marta. And I want to welcome everybody that's participating in this very relevant webinar. I'm pleased to welcome you all to this webinar to present and discuss the latest Health in the Americas report, which focuses on the Pan American Health Organization Elimination Initiative. Since 1954, PAHO has published the Health in the Americas report, a flagship document which responds to one of the organization's main mandates, to collect and disseminate information on health conditions and trends in the region of the Americas. This edition of Health in the Americas highlights the progress made in advancing the PAHO's Elimination Initiative, which aims to end more than 30 diseases and related conditions in the region by 2030. The report examines the importance of this initiative, takes stock of progress toward its targets, and advances the discussion on what actions are needed, as well as the opportunities to accelerate elimination efforts in the Americas. PAHO has supported the countries in the region on disease elimination since its founding in 1902, and significant progress has been made. The Americas eliminated smallpox in 1974, and eradicated this disease in 1980. In 1994, the region was certified as free from poliomyelitis. Over the last several decades, the region has eliminated many other diseases, including rubella, congenital rubella syndrome, and neonatal tetanus. As a region, we have made extraordinary progress in eliminating diseases. However, countries face ongoing challenges. Urgent action is required to accelerate progress towards the elimination targets. I will now switch to Spanish. Em 2019, los Estados miembros de la OPS aprovaron la Iniciativa para la Eliminación de Enfermedades, un marco estratégico ambicioso, integrado
se aprobó la
centrado en las personas y las comunidades. En septiembre de 2023,
In September 2023, PAHO signed the Initiative for Elimination to drive renewed, stronger, more consolidated efforts on the lesson learned during the pandemic of COVID-19. And this was necessary because a few months after the approval in 2019, the COVID pandemic started, and all the efforts in the countries were completely focused on the answer to the pandemic. We had a lot of delays, and in 2023, this reaffirmed our commitment at the same time to drive an interprogrammatic work and to look to support the countries and do their national plans of elimination based in their epidemiological reality, and to seek how we can accelerate the integration of new strategies in the countries in the region to accelerate the elimination. This elimination initiative is focused on 4 lines action strategies that highlight equity and are focused on situations that have greater vulnerability. And these lines are, first, strengthen health systems and the integration of health provisions. Second, improve the surveillance systems. Third, address social determinants and environmental health determinants. And four, improve governance and funding. To accelerate the efforts of disease elimination in the Americas, we must implement efficient and innovative strategies and take advantage of the new technologies, improve health information systems and the use of data to identify where the populations are that have access barriers and identify which are these barriers and adopt strategies for the barriers to be able to be fully removed. We also need intercultural focuses to improve collaboration between different sectors and stakeholders. The initiative is an opportunity that promotes collaboration and innovation to transform health results in the entire region. I invite you to learn about the regional experiences in the country and create strategic alliances and associations between communities to be able to reach and maintain the elimination objectives and keep mitigating future threats. Thank you so much, and I hope that this webinar can be a new step to strengthen our commitment to disease elimination in the region. I always have in my life an idea that I always think that if tools are available, we have as an ethical and moral imperative to make these tools and strategies to turn them into interventions that can save lives and reduce vulnerability and poverty and suffering of people. And we need to speed up this implementation. So I hope that in this webinar, you can look at the advances and also the gaps that we still have, and that we can leave here much more committed to advancing with this important initiative. Thank you so much. I thank you all for being here, and I thank all the panelists who are going to participate and show the experiences of the countries, and our colleagues of PAHO and members of our strategic advisory group that is going to be also doing an important intervention here. Thank you so much, and a great day, everyone. Thank you, Dr. Barbosa, for your opening remarks in this important webinar. I will now switch to
Dr. Patrick Lamy, Director of the Neglected Tropical Diseases Support Center at the Task Force for Global Health, and he is currently the chair of the Pan American Health Organization's Strategic Advisory Group on Disease Elimination, and he is going to give us his perspective on the Elimination Initiative and the added value of the Health in the Americas report. Dr. Patrick Lamy, welcome.
Yeah, thank you so much, Dr. Saboya, and thank you, Dr. Barbosa, for your strong leadership and commitment to the Elimination Initiative. As Martha just said, my name is Pat Lamy, and I am honored and privileged to serve as the chair of PAHO's Strategic Advisory Group for the Elimination Initiative. I'm really happy to be participating in this webinar, which is focusing on the Health in the Americas report on accelerating disease elimination. My career has been focused on building the scientific evidence base for the elimination of neglected tropical diseases, or NTDs. Our current strategies for eliminating NTDs were largely built on the generous commitments of pharmaceutical companies that donated drugs, the efforts of committed ministries of health and country teams, and in some settings, the bilateral and philanthropic donors who provided the funds to deliver these drugs to affected populations. NTD programs have been remarkably successful over the last 2 decades in providing hundreds of millions of people the opportunity to live healthier lives. More than 50 countries have eliminated at least one NTD. If we look at other global health programs, those focused on HIV, malaria, TB, and others, we also see dramatic successes over the past 2 decades. The recent questions about the status of U.S. funding for global health programs, including NTDs, have raised concerns across the global health community about future funding gaps. This possibility has cast a shadow over the incredible progress that is made in the last 2 decades and raises doubts about the future of vertical health programs. From the perspective of one who believes that disease elimination should remain an important public health goal, I can say at the outset that PAHO's Elimination Initiative provides an important alternative strategy to move this agenda forward. The report, Health in the Americas, Accelerating Disease Elimination, provides a comprehensive overview of the progress made by PAHO and the member states in reducing the burden of infectious diseases and describes what we need to do now to achieve hemispheric elimination goals. As is well described in the report, this initiative is not just another program. It's a strategic framework aimed at eliminating a set of communicable diseases and related conditions across the Americas. In the current moment, it also sketches out a different approach that provides hope and serves as a bold statement about the power of targeted collaborative action. The Elimination Initiative, or EI for short, focuses on eliminating diseases like NTDs, malaria, vaccine-preventable diseases, including cervical cancer, as well as mother-to-child transmission of HIV, syphilis, hepatitis, and Chagas disease. These diseases are not abstract threats. They're real, devastating conditions that disproportionately affect the most vulnerable among us. Each disease targeted by the EI has a profound impact on the quality of life of individuals and the health of their communities. PAHO developed the Elimination Initiative to shift the paradigm of disease elimination away from expensive vertical programs focused on single disease-specific goals toward an approach based on strengthening health systems to integrate and improve the delivery of health interventions to vulnerable and neglected populations. Elimination, then, is the consequence of a more robust and equitable health system. As detailed in the report, the Elimination Initiative provides a comprehensive approach focused on integrated strategies. The EI promotes integrated health service delivery, ensuring that elimination efforts are woven into broader healthcare systems. This avoids the siloed approach that vertical programs can sometimes fall into and creates more sustainable outcomes. The EI prioritizes reaching vulnerable populations, addressing health inequities, and ensuring that no one is left behind. This is crucial because these populations typically bear the burden and the greatest burden of the diseases that we're trying to eliminate. The EI emphasizes the use of robust data to guide interventions, monitor progress, and ensure accountability. This allows for targeted and efficient use of resources, which is especially vital in times of limited funding. The initiative focuses on collaboration across countries, enabling the sharing of best practices, resources, and expertise. This collective approach strengthens our ability to tackle these diseases effectively. The EI is designed to strengthen health systems, as Dr. Barbosa noted, ensuring that the gains made are sustainable over the long term. This focus on the long-term capacity building is essential for preventing resurgence of diseases once they're eliminated. To be clear, the impact of these elimination efforts extends far beyond disease elimination targets. It translates to healthier lives, stronger communities, and a more equitable society. By focusing on vulnerable populations, we're not only addressing health disparities, but we're also investing in the future. Every child protected from congenital syphilis, every woman screened for cervical cancer, every family spared the devastation of Chagas disease represents a tangible outcome that matters. In the face of potential funding cuts, we must advocate for continued support for global health and, in particular, integrated country-led efforts like the EI. We must emphasize the cost-effectiveness of prevention and elimination, the ethical imperative to address health inequities, and the long-term benefits of investing in health. We must work together to ensure that the progress that we've already made is not lost and that the vision of a healthier Americas becomes reality. To be successful with this bold initiative, we can't be satisfied with the status quo. I'm going to put my hat as a scientist back on, and I'd like to emphasize a few areas where the Health in the Americas report indicates that innovation is needed so that we can do things better. Paraphrasing my colleague on the Strategic Advisory Group, Dr. Ethel Maciel of Brazil, we do a good job of collecting data, but we don't do so well converting that data into actionable information. As noted in the Health in the Americas report, countries need to modernize their surveillance efforts with interoperable information systems and data platforms to support a timely outbreak response. This means that we must transition from paper-based to electronic platforms. PAHO has led efforts to use new integrated serosurveillance systems to monitor disease prevalence and to define gaps in service delivery. These types of multiplex bead assays provide an important platform to integrate monitoring evaluation across public health programs. We definitely need to expand this work. For all types of data that we're collecting, we should take advantage of new artificial intelligence tools to capture and analyze that data so that it can guide public health decision-making. Putting these ideas together, we need to generate high-quality maps to show the overlapping distribution of diseases and how they are concentrated among vulnerable populations. We need to define and support integrated service delivery wherever possible, using models like PAHO's EMT-CT Plus strategy to eliminate maternal-to-child transmission of HIV, syphilis, hepatitis B, and Chagas. As Dr. Barbosa mentioned, we need to really develop solid partnerships with communities to ensure that health delivery is aligned with community needs. We need better diagnostics for patient diagnosis to guide treatment decisions and to maximize the benefits that patients can receive from a single healthcare visit. We need regional capacity to support the production of drugs and diagnostics that countries need. And finally, we need to remember that health is not a privilege, it's a fundamental human right. Clearly, we have a lot of work to do, but what is important in the moment is to recognize that we know what we need to do, and we have a new sense of urgency about the importance of this work. I urge all of you on the webinar today to read through the report and to reflect on the strategies that it describes. I think you will conclude, as I have, that the Elimination Initiative represents an important and powerful strategy to address health inequity across the region. Let me close with a few important take-home messages that I want you to take away from this webinar. Number one, it's focused on neglected populations, and that's a really important attribute in terms of addressing health inequities. Two, it puts the countries in charge of setting their own priorities. Three, it improves efficiencies by making integration the cornerstone of disease elimination. And four, it focuses on improving the way we use data to make public health decisions. Thanks very much for the opportunity to speak today. Back to you, Dr. Saboya.
Thank you very much. And that we have a double sound here.
About the Elimination Initiative and the Health in the Americas report. We really appreciate your role and your complementary information on the opening remarks by Dr. Jarbat Barbosa. We really appreciate it. So now we are going to continue with the next topic on the agenda that is regarding presenting the Health in the Americas report and the Elimination Initiative regional data portal in which you will find important information about the Elimination Initiative. I now welcome Dr. Adrienne Cox. She is the Health Analysis and Equity Metrics Unit Chief at the Department of Evidence and Intelligence for Action in Health at the Pan American Health Organization, who is going to present the Health in the Americas report focusing on the disease elimination. Adrian, welcome.
Thank you so much, Martha. First of all, I want to say that this is a collaborative effort around the House. I want to thank the coordinating committee for the report, which consists of people from CDE, Martha, definitely people from the Department of Evidence and Intelligence for Action Health, particularly the Health Analysis Unit, and people from GHU, CCP. But not only that, definitely everyone from all of the technical entities that coordinated input, efforts, resources, and those of our colleagues in the PWR country offices, which work with national authorities to collect information so that we have this report. So it truly was a collaborative effort across all of PAHO and the member states. I want to give you a little bit of background about health in the Americas. As we have reinvented it in the last few years, in 2021, we launched the new Health in the Americas portal, which basically allows for more interactive information and data on health in the Americas and is an ongoing thing, not just a one-time report. Also, changing to the thematic role of what are the priorities that we have in public health, the current events that affect all of the member states and within our region. So we first started with potentially avoidable mortality that we published in 2021, followed by the overview of region of health in the Americas in the context of COVID-19 pandemic. And then now we have the accelerating disease elimination that was published in short last year with the full report this year. We also have the country and territory profiles, which have information of over 80 health indicators with a country perspective on each of these thematic events. And that is a lot of work that the member states put into how do these particular topics, how are they managed, how are they addressed at the country level. For Health in the Americas, the goal of this report was really to provide a comprehensive overview and a strategic analysis of PAHO's disease elimination initiative, where we're eliminating more than 30 communicable diseases and conditions in the region. Highlight its significance, as you heard the keynote speaker, Pat Lemmy, mention, the historical context, the challenges, the opportunities, and the impact, and then what we have left to do. So in this sense, we want to inform, mobilize stakeholders toward the accelerated progress and disease elimination. Here you can see the link and the QR code to get to the Health in the Americas portal and the report in all the different PAHO languages, English, Spanish, Portuguese, and French. For accelerating the initiative, the report really has key messages that addresses why do we need the elimination now? What are the impacts of disease elimination on the people and conditions? How do we highlight the profound impact on disease elimination in terms of social development, economic outcomes, with the lens on equity? What makes a difference from EI, different from previous disease control efforts that improve lives in the Americas, and then also detail the call of action we have. Now I'm going to hand it over to my colleague, Dr. Savoya.
Thank you, Adrian. And I'm going to switch into Spanish now. And I hope we can have, okay. Excelente. Muchas gracias, Adrian.
Okay, excellent. Thank you so much, Adrian, for presenting the information that we have in the Health in the Americas report focused on the progress in the region towards the elimination of communicable diseases. And you're going to find in the report that there's data gathering and gathering of analysis of said data to be able to establish where we're at in the region in terms of challenges and opportunities. And this data, a lot of it, not only in the Americas, It comes from the regional data portal of the Initiative of Disease Elimination in the Americas that you can find in this QR code that is right here. And we have gathered information at country level and sub-region and the regional level for two important aspects. One, what are the indicators of elimination that we are monitoring the elimination of each one of these conditions and related diseases? And second, if there are indicators, I have the pleasure to announce that we launched in the portal this week a series of indicators with which we're monitoring what is happening with these transversal action lines that Dr. Barbosa mentioned in his opening remarks that are critical areas in which we need to move forward to be able to ensure that we're able to improve the quality of life and save lives faster and in regards to these 30 diseases. Thank you. Next, please. This is just an example of a couple visualizations that you can find in the regional portal of the initiative. And here you also find a country profile. You can go in, select the country that you wish to select, and look at what are the diseases that were eliminated in this country of the total of over 30 that are in the elimination initiative, and where the country is very close to reaching this goal, and it becomes an incentive to reach the achievement. And where do we require a lot more efforts if we really want to improve the quality of life of these populations and reach the elimination of these diseases?
De indicadores de eliminación que los invitamos a consultar. Siguiente.
And you will also find very rich information that has been published this week in the indicators portal for each of the action lines. So each of those 4 lines Dr. Rubens has mentioned are paramount in the initiative. And that's where, at this point, we pay full attention all the regional efforts so that we can improve access to integrated healthcare services, surveillance systems, and that way we can accelerate the approach to these healthcare determinants that are also aligned by these diseases and conditions, and to be able to work in the governance and the direction and the accelerating and speeding of this. So in this portal, you'll find 29 indicators. There are an approximate of how could we monitor those lines at a country level by comparisons by area, as you can see on the map. So this is our invitation for you to inquire and to specifically use the data that you find there in combination with the set of data countries have, as Dr. Pat mentioned, to use the data and the information for better and more speedy decision-making in the implementation of healthcare services in the Americas. So with that, we're going to finish this presentation and want to invite you to analyze, use, and enrich the information that we have in the regional portal for this initiative. I want to thank Adrian for having shared this space with me to present to you this report, but also that I insist is very rich, but I also want to tell you that you need to keep looking and keep visiting. Now we're going to move to the panel to look at the countries and see how is it that we can work with the actions of elimination of diseases. And many countries in the region are working with great efforts to be able to accelerate this approach. I want to invite Dr. Sebastián Garcia. He is the Director of Evidence and Intelligence for Action in Healthcare for PAHO. And he's the one who is going to be moderating this very rich panel of experiences, perspectives, and opportunities in the countries of the Americas region. So, Sebastián, we're all yours. Thank you, Marta. Such a pleasure to have this participation in this webinar to now introduce a section that we've scheduled to allow countries in and give space to the actual experiences and everything that we've mentioned and the great lines that have been stated by the strategies, the experiences around it, and the understanding that we are working with the elimination in the Americas and in our countries. It isn't an easy task. It is a job that has been done for many years. We have vast experience from the very fields where these initiatives have been applied. And of course, we want to hear and we want to complement with what it's already reflected in the report, in this report of healthcare in the Americas, from the very experiences, and of course to hear about the future and how to utilize these tools that we have at hand. We have 4 wonderful panel members, and we really appreciate that you are with us today. So I'm going to introduce Dr. Alda Maria de Cruz. She is the director of the Department of Communicable Diseases from the Ministry of Health in Brazil. Thank you very much, Dr. Alda Maria de Cruz. I want to also welcome Dr. Adriana Castillo Castañeda. She is a leader in the framework of the National Plan for the Elimination of Diseases in the Ministry of Health Care and Social Protection in Colombia. Ms. Julie Douglas Johnson, she is a senior. And also the Honorable Dr. Manuel Zambrano, the Vice Minister of Healthcare in the Ministry of Health from Panama. So much appreciate to our panel members, and also to encourage a good conversation and interaction with the audience. We have opened the Q&A session, the chat as well. And so in the Q&A session down there, you can add your questions, whatever they may be. I want to begin with Dr. Alda Maria de Cruz with a question about her experience that in this living within the application of the initiative of this vision, what are the next key steps mentioned in the report of healthcare for the Americas that could help us beat the elimination of diseases in Brazil, according to the experience you have? Dr. de Cruz, go ahead. Un placer estar aquí. It's a pleasure to be here. I wanted to greet Dr. Sharmas. I would like to greet everybody who are facilitating and participating in this webinar. And the panel members. She has her microphone all the way on the top, so we can't hear her. She needs to bring her microphone down. If someone could please interrupt her and tell her so. We were working with initiatives that were isolated. If Dr. Sebastian could please tell her to bring her phone down. Thanks to the group of healthcare and the environment. And we were able to begin with a program that was very important at a committee for the elimination of tuberculosis. And this was very, yes, please, Kim, if you could interrupt her. This ensures that the governmental commitment exists and it is consolidated once the topic of diseases that will exist in of the BRICS countries here in Brazil. To bring into context. Thank you so much. Thank you so very much. Oh, much better.
Desculpa, não prestei atenção.
I'm sorry I hadn't paid
Bom,
attention.
então,
My
como eu vinha
apologies.
falando, o
Thank you
compromisso
so very much,
governamental
everybody.
e esse compromisso,
So
ele
as we said
agora
in the
com os
governmental
BRICS, né, fica
commitment
bastante claro, então
with
uma
BRICS, it
cooperação
is
também
really very
que vai
clear
haver
now, and
entre
it is
os
also a
países que
cooperation
compõem esse
that will
bloco. Então,
exist,
nós estamos alinhados com os
and we
países
are
das
aligned
Américas, né?
with the
E
countries
agora
in the
também, né,
Americas, and
podendo
right now as well,
expandir essa
being
atuação.
able to expand
Então,
these
assim,
actions a
esse
bit.
programa Brasil Saudável, né, que é
Now,
o
this
programa de
program,
eliminação de doenças, ele está
Brasil
totalmente
Saludable, Healthy Brazil, which
pautado
is a program
nas
for the elimination of
prioridades
diseases,
da
is
Organização Mundial da
fully
Saúde e da Organização
focusing on the
Pan-Americana.
priorities of WHO and PAHO
E
as
isso,
well.
a importância dele é que ele conseguiu
And the
unir,
importance
né,
of it is
em um
that
só
we are
programa
able to
todas
put
as
together
doenças
in one
na
program, in
eliminação.
one single program,
E,
all
e mais
diseases
importante aí na
and the,
linha do que
that
foi
are in the
dito
process
pelo
of
Dr.
elimination, but
Jabras, pelo
most
Dr.
particularly
Pat, né,
in
de
attune
considerar
with what
que
Dr.
a
Jabras and
eliminação
Dr.
das
Pat said,
doenças, ela
to also
necessita
consider that
de
the
outros
elimination of
instrumentos para além da
diseases
saúde. A saúde, o
demands
Ministério da Saúde
other tools
sozinho,
in
ele não
addition
vai
to
ser
the Ministry of
capaz
Health,
de
which on its own is not going to be able to achieve it.
atingir as metas de eliminação, porque
It's not going to be able
precisamos
to
de
reach these elimination
efetivamente
targets because
trabalhar em
we
cima dos
need to
determinantes
actually be
sociais.
able to
Então,
work
o Brasil
together
vem trabalhando
in the
muito
help of social
nessa
determinants. So
questão. Então,
Brazil's worked hard,
não só
very
na
hard on
Seguridade
this,
Social, garantindo,
not
buscando
only
instrumentos que
in
garanta
Social
o
Security to
suporte financeiro
guarantee
para as
and
famílias,
finding elements that can ensure financial
sucumbindo os
support for
exemplos, né?
families.
Buscando
And
a
this is just as an
interface com
example, but
outros
also
ministérios que
trying to
cuidem
find
da
interfaces with
infraestrutura,
other
como é o
ministries
saneamento
to help
básico.
care for
Hoje
the
tivemos o
infrastructure like
lançamento de
basic
estudo
health
muito
care.
importante de um
Today, in
instituto
fact, we launched a
que
very important
fez
study from
levantamento
an
do saneamento básico no
institution
país.
that conducted an
Então, acho que é
analysis on basic
conjunto
healthcare in the country.
de atores que vem
And
atuando. Mas vindo
there
aqui
was this
mais
group of
especificamente na
actors,
pergunta, os passos-chave, né?
but most
Eu
specifically with
queria
this question
destacar
on the
aqui
key
duas
steps,
questões, né?
where I would like to
A
highlight two
primeira é a
things.
questão das fronteiras. Para o Brasil, ela
First
é
thing
muito
is about the
fundamental
boundaries and the
e em
borders. For
algumas
Brazil,
doenças especificamente.
is
Nós
paramount, and
estamos
most
falando de
specifically with some
malária,
diseases. We're
estamos
talking
falando
about
das
malaria, for instance. We're talking
oncocercoses,
about
estamos falando de tracoma. São três
onchocercosis,
exemplos
and we're also working in istacoma. These are
cuja
three
eliminação
examples
vai depender
of
de uma
diseases which
cooperação muito
elimination will
grande entre os países da
depend
fronteira.
in a
Eu
very
vou
big
colocar aqui
cooperation
o
among the
exemplo
countries
da
on
terra
the borderlines. And
equatoriana,
I'm going to
boliviano
talk
mesmo,
about,
onde o
bring an
território
example
ele é
with the
compartilhado
Yanomami
com a
people,
Venezuela
where their
e o
territory is shared
fluxo
with Venezuela.
dessas pessoas, dos indígenas entre os
And
dois
their
países,
incoming and
ele
outgoing
é
flow of
extenso.
indigenous
Então,
nations between both countries
nossos
is very
esforços têm
intense.
sido
So
para
our efforts
trabalhar essas questões
have been
fronteiriças.
about working with these
Hoje
elements
mesmo nós
of
teremos reuniões sobre isso
border
e
movements and immigration. And so
esse é
we
um grande
have meetings
desafio,
on that.
porque as
And this is a
doenças, os
great
patógenos,
challenge
eles não conhecem fronteiras. Então,
because
nesse sentido,
diseases and pathogens have no boundaries in that
intensificação
sense.
desse
So for that,
esse instrumento, essa
the
iniciativa que foi apresentada
pushing
agora
this
pela doutora
instrument through
Marta e
the
pela doutora
initiative
Adriene
that
são
was
muito importantes,
promoted
né?
by Dr.
Porque elas
Martin and Renan
permitem com que
are
a
very
gente
important because they
permeie essas
allow
informações.
for us to be
Especificamente,
able
quando a gente
to
fala sobre
generate
os
the
países do Cone Sul,
transferring of
o
this information,
Mercosul ele já
particularly
tem
when we
uma
talk about the
iniciativa que é o Comitê de
southern
Vigilância em
countries.
Saúde, que se reúne a cada 2
Mercosur has
anos
already an
este ano.
initiative, the
Esse
Committee of
ano
Surveillance in
foi
Healthcare,
realizado,
which
vai
gathers
ser
every
com a
2 years. This
Argentina,
year,
e no
taking
segundo
the
semestre é
opportunity
o
of it
Brasil
being
que estará à
introduced, will
presidência.
occur
Então,
in
esse bloco
Argentina,
é um
and the
bloco
second
que
semester
vem
will
caminhando
be
muito
Brazil.
conjuntamente,
So
né,
this
não
is a
só
block
para as doenças e eliminação,
that has
mas
been
para
leading
outras
together, not
áreas
only for the
desse
elimination of
portfólio.
diseases, but also
E estamos
others in the
trabalhando
portfolio.
aqui no Ministério
here in the
Ministério
Southern
para
Cone.
gerarmos blocos de interação
So from the ministry, we've been
com
working to
os países
create
da tríplice
spaces or blocks of
fronteira, por
interaction
exemplo, né?
with
Lá
the triple
na
frontier countries
fronteira
here in the Southern
entre
Cone,
o Amapá
like
e
in the
a
borders
Guiana
between the
Francesa, a
Amapá
própria inter-relação
and
com
French
a
Guiana,
Venezuela,
and
e
the
esse é um aspecto
interaction with
aonde
Venezuela
a
as well.
participação
And this is an
da
aspect with
desse
where the
da
participation
da Organização
of
Pan-Americana vai ser muito
the
fundamental.
PAHO
Outro ponto que eu
particularly will
queria
be
destacar são as
fundamental. Something
experiências
else I also want to
pós-eliminação.
stress here
Temos
has to
dito
do with the
aqui que para
post-elimination
importante tanto
experiences,
eliminar uma doença
since, as we've mentioned,
fazer a
they're very
vigilância
important as to
pós-eliminação.
eliminate a
Estamos
disease, to
trabalhando
also
também
work with
nessa
these
agenda
post-elimination
e
surveillance. We're
compartilhar
also
com os
working with
países
this
que
agenda in
já
sharing with the
conseguiram a
countries
eliminação de doenças e que estão
that
nessa
already
fase, né? Então, a
achieved the
experiência
elimination
desses
of
países
diseases and
vai
that
ser
are
também muito
undergoing the
importante para que o
phase
Brasil
and the
possa
experience with these countries
trabalhar
is
os
going
seus
to be
programas de pós-eliminação.
very important for
Teremos, doutor
Brazil
Jarba, eu já
to
antecipo
work in the
aqui, uma
post-elimination
oficina
programs
de
with Dr.
pós-eliminação da
Jarvis.
trombose linfática, que é
We
uma das
have a
doenças que
post-elimination workshop
eliminamos, tivemos essa validação no final do
with
ano
the first disease
passado,
that we were
com
able
a
to eliminate
do Dr.
at the end
Jarba,
of
que
last year
muito
with the
nos honrou,
presence of Dr.
e
Jarvis.
estamos agora seguindo nesse programa
And we are
que vai
now
acontecer
giving
em
follow-up to this
Pernambuco,
event that will
agora
occur in
nos próximos
Pernambuco
meses. Estamos organizando para
for the
abril.
next months.
Eu acho que esses eram os pontos
So
principais que
we
eu queria
are
destacar.
conducting these events. These are like the most important events that we're having ahead. Thank you very much, Dr. De Cruz, for this amazing perspective of challenges and how you've moved within an agenda that is certainly strategic and priority for Brazil, which takes me to the next item, and I'll introduce again and thank very much for the presence and participation of Dr. Manuel Zambrano, the Vice Minister of Health in Panama. And I want to ask you, Doctor, about the process of alignment with the national initiative in Panama with the regional initiatives and the establishing of challenges, shared challenges and pathways toward 2030. Mr. Vice Minister, or Deputy Minister, thank you so much. And I want to hand the microphone to you so that you can share with us about that very hard work that connects with this very rich experience. We heard a few minutes about Brazil from Dr. De Cruz. Floor is yours. Over.
Está en mute. No se escucha.
Doctor Zambrano, no lo escuchamos. No sé si está el micrófono en mute.
Saludos a todos. Es un honor compartir el trabajo que Panamá está realizando. ¿Se escucha?
No escuchamos.
Saludos a todos.
Perfecto.
¿Ahora sí?
Sí.
Perfecto. Ok. Saludos a todos. Es un honor
Greetings,
compartir el
everybody.
trabajo que Panamá está realizando para avanzar
We
en la
want to share the
eliminación
work
de enfermedades transmisibles,
Panama is
alineado con la
conducting
iniciativa de la
for
Organización
the
Panamericana de
elimination
Salud,
of
que busca
communicable
eliminar
diseases.
más
I'm
de
sorry,
30
he has a lot
enfermedades
of
para el
echo.
2030.
Trying to
Actualmente,
find
Panamá está en
the
proceso
elimination of
de
diseases for
elaboración del
2030.
plan estratégico de
Panama is
eliminación
currently
de
drafting the
enfermedades,
strategic
lo que
plan
demuestra el compromiso del
for
país
the
con
elimination of
este
diseases,
objetivo regional.
thus showing the
Este
country's
plan
commitment
sigue las recomendaciones
with
de
this
la
regional objective.
iniciativa de la OPS
This
y
plan is
se
following
construye a
PAHO's
partir de
initiative,
un enfoque basado en
built
el
from an
fortalecimiento de
approach
la
based
integración de los
on the
sistemas de
strengthening
salud,
of the
la
integration of
prestación de servicios de
healthcare
salud,
systems
así como
and
Disculpe
the
interrumpirlo, doctor. Nos mencionan los intérpretes que hay bastante eco en el cuarto ahora. No sé si pudieran, de favor, ajustar su micrófono y también mantener un nivel un poco lento para los 3 canales de interpretación. Muchas gracias.
este plan sigue las recomendaciones de la iniciativa de la OPS. ¿Se escucha bien?
Nos confirman que sí, muchas gracias.
Y se construye a partir de un enfoque basado en el
It is built
fortalecimiento de la
as of
integración del
an
sistema de
approach in
salud
the
y la
strengthening
prestación
of the
de servicios de
healthcare
salud,
systems and the provision of
así como
healthcare
también de
services,
los sistemas de
as well
información y
as
vigilancia,
information and
también el
surveillance
abordaje de
systems,
los determinantes
along
sociales
with the
y
approach
ambientales,
in the
y
addressing
no
of
menos
social and
importante,
environmental
la mejora de
determinants,
la gobernanza, la
and also the
tesorería y las
improvement of
finanzas.
governance, guidance, and
Como parte
finance.
de este proceso, se han
As
realizado
part of
4
this
talleres
process,
estratégicos, los
4
cuales
strategic
han sido
workshops
clave
have been
para
conducted,
definir prioridades, identificar
which have been
brechas
key
y
to establish
estructurar
priorities,
una hoja de ruta
identify
para los
gaps
próximos años. Estos talleres han permitido
for the years to come.
el diagnóstico y priorización de
These
enfermedades,
workshops
donde se
have
ha logrado
enabled the
identificar
diagnosis
enfermedades en las que
and
Panamá
disease
tiene
control,
potencial de
identifying
eliminación,
those where
como
Panama has a
lepra,
potential for
Chagas
elimination,
congénito, malaria,
congenital
fiebre
Chagas,
amarilla,
malaria,
cólera,
yellow fever,
hepatitis B y
cholera,
C, HIV,
hepatitis B and
bacterias
C,
infantil y sífilis congénitas.
HIV,
Además, se han
mother and
analizado la
child, and
capacidad de
congenital
actuación
syphilis.
del sistema de salud para
Also
fortalecer la vigilancia
analyzing
y el control.
the way to establish surveillance and
También se
control.
han definido estrategias de acción. Se
Action
viene trabajando
strategies have been also
en la
defined
identificación de intervenciones
to work on the
clave para
identification of
fortalecer
clear
la respuesta
interventions to
sanitaria,
strengthen
incluyendo
the
el uso de
healthcare response,
tecnologías de
including the use
monitoreo,
of
estrategias de
technologies for the
vacunación y
monitoring,
control vectorial.
vaccination
Se
strategies,
han
and
planteado
vectorial control.
mecanismos para mejorar la
Mechanisms have been
articulación
stated
entre
to
sectores
improve the
y asegurar
articulation
un
among
uso
sectors
integral de
and
la
to
intervención de
ensure a
enfermedades.
comprehensive
Con el
approach in the
equipo
intervention of
técnico
this
se
disease.
elaboró una
With the
línea de
technical team,
tiempo para
we put
implementar
together
la
a timeline
implementación. Esta
for that
incluye una hoja de
implementation,
ruta con
which
metas
includes a
progresivas
roadmap with
hasta el
progressive
2030,
targets toward
alineadas
2030,
con la iniciativa de la
all aligned
OMS.
by
Dentro
initiatives
de
from
estos se
PAHO.
han establecido
And within
hitos que
those,
incluyen el
milestones have been
fortalecimiento de la
established
vigilancia
to include the
epidemiológica, la
strengthening of
integración
epidemiological
de
surveillance,
servicios de salud y la
integration in
utilización de
healthcare
recursos
services,
para
and the
garantizar
management of
la
resources
sensibilización del
to
plan.
guarantee
Ha sido esencial
the awareness of this
la
plan.
articulación entre los actores clave,
Articulation
por
among
lo que
key
se ha
actors has been
trabajado
paramount.
en la coordinación
Having worked in
interinstitucional
the
e
interinstitutional
intersectorial,
and intersectoral
incluyendo
coordination,
actores nacionales de
including
múltiples
national
sectores,
actors from
para
multiple sectors,
garantizar la
to
implementación del
guarantee
plan con un
the
enfoque
implementation of the
integral y
plan
sostenible.
with a comprehensive and
El
sustainable
trabajo que se
approach.
está realizando actualmente es
The work
fundamental.
being conducted
Sentar
currently
las bases de una estrategia efectiva
fundamentally
y
demands to
homogénea
lay the
para que las
baselines
metas de eliminación de la
of
OPS
mutual
y como he
collaboration
dicho, el
and the
plan
implementation of
estratégico
PAHO's
que será
tools, as
publicado
well
a
as having
finales
the
del
strategic
próximo
plan
mes.
ready, which will
A
be
través de este
communicated
proceso,
at the end of next
Panamá no
month.
solo
And through that
avanza en
process,
la
Panama is not
formulación de un
only
plan
progressing in the
estratégico, sino
formulating
que
of a
refuerza su
strategic plan, but is
compromiso
also
con la
reinforcing
salud
its
pública y la
commitment with
eliminación
public
de
health care
enfermedades
and the
transmisibles
elimination of
heredadas.
communicable diseases
Muchas
in the
gracias.
region. Thank you very much.
Muchas gracias, viceministro, por esta clarísima ruta
Thank
que han
you,
seguido y de
Vice
las
Minister, for
cuales
this,
la
or
región
Deputy
se
Minister, for
siente
this work
orgullosa
you've
de
done. The
poder
region is very
acompañar
proud
al
to
país. Y me refiero a la
be
región
able
en el más
to
amplio, es decir, no el
be with the
secretariado,
region.
no la OPS como secretariado, sino
And
los
this,
países
and
que
PAHO
se
not
suman
only as a
a
secretariat,
esta
but the countries
iniciativa y
that
que buscan
add to
precisamente eso,
this
coordinar los
initiative and
esfuerzos,
that are trying
acompañar
to work
estos
together
esfuerzos y
in these
tener
efforts
toda la
and
capacidad que
having
se
all
logra
the
justamente de
capacity
la interacción entre
achieved
expertos que tenemos en
through
la
the
región
interaction of
y
the
por
experts that we
voluntades
have in the
que se
region,
tienen en los
putting
entornos
together all the
locales. Así que,
wills
viceministro,
in
muchísimas
every
gracias por
sector.
esto
So
y me lleva
we
también
thank you
ahora
very
a
much
presentar a nuestra
for this,
siguiente
Deputy Minister.
panelista, la doctora
And
Adriana
that leads
Castillo
me to also
Castañeda,
introduce
líder en el
Adriana
actual Plan
Castillo
Nacional de
Castañeda,
Eliminación
a
de
leader in the
Enfermedades
framework,
del
in the
Ministerio de Salud y
transnational
Protección Social
framework
de
from the
Colombia,
Ministry
justamente
of
para
Healthcare
ahora
and Social Protection of
vincular o
Colombia
desvincular de
for the
este
elimination of
reporte que
diseases,
estamos
trying to
presentando, este
help
reporte que
us link
busca
this report
posicionar
which
el
intends
de
to
salud en
position
las Américas,
in the
aceleración
terms of
necesaria
healthcare in the
hacia la
Americas is
eliminación de
very
enfermedades.
important.
Doctora
Acceleration
Castillo,
toward the elimination of
platíquenos un
diseases.
poco, ¿cuáles
Dr.
son
Castillo,
algunos de estos
can you tell us a
elementos
little
que
bit about
mencionan
some
en
of
el
these
reporte
elements
que
mentioned in
son
the
claves
report
en la
that are
aceleración
key
que Colombia
and the
busca para
acceleration
llegar
that
a la
Colombia
eliminación
is
de
looking
enfermedades?
to eliminate diseases?
Good morning, everyone. Can you confirm that you
El
can
sonido
hear
es un
me?
poco bajo.
Barely. Barely. We can barely hear her. No?
Muy poco. ¿Puede tratar de hablar un poco más fuerte, por favor?
Can you please try to speak a bit louder? Okay, can you please interrupt me? We can't really hear much of what she's saying. So,
Doctora Castillo, perdón, la
on behalf
escuchamos
of
muy
Colombia,
bajito, muy lejos. No
no,
sé si podamos cambiar
we
el
can hear you
micrófono
at a very, very low volume. We
usar
can hear you
entrada.
there. Can you hear me now? Yes. Yes, thank you. Okay, perfect. Thank you so much. I would love for this to be the opportunity not only to thank you for your invitation to actively participate in this webinar, but also for all the support that you've provided to Colombia within the framework of the generation of the National Elimination Plan in eradication of communicable diseases and priority conditions from the National Ministry of Health and Social Protection, headed by the Minister Guillermo Jaramillo and the Vice Minister Jaime Urrego. I want to thank you. Now, in Colombia, since 2014, we launched officially the initiative for elimination that is taken on by the ministry, of course, aligned with all the action lines and all the roadmap of the Pan American Health Organization. So I would like to mention that when we did the review of the report, we found a lot of information, and I will be stating it shortly. And we have two main comments. The first one, that it is timely and necessary not only to recognize the difficulties and the gaps that we can have as countries when proposing and implementing strategies that are useful for the elimination of these diseases, but also we'd like to recognize the strengths and gather the success of the objectives achieved in terms of public health historically by the country and the region. And with this, I want to thank everything that was mentioned in the report on the scope of the elimination goals of immunopreventable diseases in the country. And as an example, we have this, and as it was being mentioned by the doctor of the Ministry of Brazil, it's important for us also to think and project surveillance post elimination of all of these diseases, guaranteeing and bringing together efforts to prevent them from happening again and from affecting the citizens again. And I gathered a few examples on the operating lines related to both achievements that the country has, as well as improvement opportunities that were identified that are useful for the acceleration of these diseases. So first, in the action line of strength and integration of health systems and service provisions, in the 10-year health plan 2022-2031 by the National Ministry of Health, one of the most important points is the implementation of the basic teams for healthcare, primary healthcare. And these are already implemented nationally, and they will actually be like our arms in the territories to be able to implement actions for diagnosis, for timely diagnosis, for treatment of diseases and the disabilities that could have been generated by these communicable diseases that we wish to eradicate. For your knowledge, Colombia has the goal of eliminating 21 communicable diseases, and among them, we include the follow-up of the elimination of some diseases, and as a priority environmental condition, the elimination of the use of contaminating biomass. On the other hand, another one of the statements in the report was on the local or regional production of medications. And this year, maybe you've heard about or from our president, and in alliance with the ministry and Universidad de Antioquia, they've proposed to start doing studies for national production of medications that are used for the treatment of malaria and Chagas disease, among others. And this is an important advance as a country to be able to face these eventual problems in the distribution of medications in the territory. And I also bring out the fact of recommendations on the report on digital health and telemedicine. And in the specific case, also, you mentioned examples from Suriname and Haiti on collaborators, on community collaborators. In Colombia, since starting last year, we've been implementing voluntary collaborators to help manage non-complicated cases of malaria, mainly in rural and dispersed rural areas. However, you were mentioning in the report the success that you've had with floating communities or itinerating communities and in border communities also, that, as the doctor from Brazil was mentioning, it's something that's really important considering that, as she was saying, diseases know no borders. So this is something that could be very valuable when strengthening diagnosis and timely treatments in these areas where we have great mobilizations of people in the borders. Along the second action line, we have the strengthening of surveillance in healthcare information systems. I went into the information system and I looked at the report that you have and IS4H, and fortunately, Colombia has reached several of the proposed indicators for the region. However, there are 3 indicators within the intermediate and immediate results where Colombia either did not reach the indicator or reached it partially, or the implementation is yet at risk. And the guarantee of the indicator, mainly at financial level of the information systems. And this is going to be very useful for us because we are currently in the projection per se of the activities of the key activities and sub-activities that we need to implement in the country. So it's about being able to gather this information on these indicators and be able to generate strategies that really allow us to improve and can help us with the scope, and this will be useful for us as a country. And it's also very important to know that we have, or we know, and we recognize that our information systems and the platforms for information acquisition right now aren't entirely interoperable and they are not integrated. And this is something that we really need to start paying more attention to and point towards so that we can really have platforms that will allow us to have a more timely analysis of information, the information that is gathered in health and information that helps us as early alerts and early warnings, because this is required to be in real time, and that allows us to have, as a country, the possibility of doing a follow-up on all the advances that we obtain in terms of elimination and eradication for the country. So therefore, for us, it's very valuable to get your recommendations or advices of including a standardized stratifiers to use these in these forms that will be adjusted. And this leads me to my next point, which is everything related to social determinants of health and environmental determinants, because even though Colombia has had since 2014 an intersectoral commission on public health in which There are meetings in high government, for example, ministers and their delegates, not only at health level, but also environment, education, and housing, and technologies, ICTs. We now recognize that we can fall a little bit short in the actions that we could implement. Therefore, we need not only to speed up the execution, the intersectoral execution of activities in sanitation, in poverty reduction, in everything related to health, education, but also having the capacity to measure the impact in health that the strategies are having in the communities. So they're also mentioning the health inequity monitoring, and I looked at this, and basically in Colombia, when we start to think of what information we have on determinants and inequalities together with the National Health Observatory, we see that there's a lot of information, but we need to bring it together, consolidate it, and analyze it. And it's looking at this equity monitor that brings a call to the active participation of Colombia, and to be able to have data that we can actually analyze and quantify, and thus adjust the strategies that we are proposing accordingly in the National Elimination Plan. And then finally, in regards to the strengthening of governance, administration, and finance, the country has a strong position, a strong political position on the elimination of these communicable diseases. From the Vice Ministry, it is one of the priorities that the office has to be able to publish the transversal plan, because we're planning on publishing a big plan and then specific plans for each one of the 22 events. To later be able to scale this to the territorial planning in the health services plans that are adjusted by the departments as well as by the high category municipalities. And then finally, I'd like to mention that we need to create alliances between the public, private, and sectors and civil society. And this is one of the important aspects that are mentioned in the report, and thus guarantee the investment and to have it be sustainable not only in time, but in all the territories, especially considering the high heterogeneity that Colombia has in regards to culture and demographics and geography, and also the distribution of diseases in the national territory. Thank you so much.
Muchas gracias,
Thank you
doctora
so
Castillo
much,
Castañón, por
Dr. Castillo,
esta amplísima perspectiva,
for
haciendo
such a
además
broad
una vinculación
perspective,
directa con el informe de
also
Naciones
doing a
Unidas. Me queda un
direct
punto que
relationship
ambas han
to the
mencionado
report.
en
I
sus
want to
intervenciones desde
bring
aquí
a
al
point that
principio,
has been mentioned in all
sobre la
interventions from our keynote
importancia
speaker
de fortalecer
all the way to
nuestros
you on the
sistemas
importance
de
of
información.
strengthening our
Y esto
information
responde
systems.
también a mi
And
lado
this,
en
of
este concepto
course,
mucho más amplio de transformación
together with this
digital del
much
sector.
broader concept of
Podamos
digital
recibir no
transformation
solo
of the
de
sector.
mejores datos, sino de
We
todas
can
las
use not
herramientas
only
que hoy
better
esta
data, but also
tecnología
all the
pone
tools
a
that this
disposición y que
digital
nos
era
permita
makes
tanto
available to us
orientar
today.
nuestras
And that
acciones
will
como
allow us not
orientar
only to guide our
diferentes
actions, but
iniciativas
also to
que
assess these
acercarse
actions in
cada
a
vez
way
más a las
that seek
personas. Y
to
con esto,
get closer to
switch
the
to
population.
English and go all the way now to the Caribbean. And I need to announce a change. I had presented our panelists from the Caribbean before, but we had to make a last minute change due to some connectivity issues. And I have the pleasure to present Ms. Larissa Mark, who is the National Epidemiologist of the Ministry of Health of Grenada, and who is also a champion in the digital transformation of the country. And with this, I ask Dr. Mark on the perspective from small countries where low-burden communicable diseases present unique challenges in the final stages of eliminations. What aspects of the Health in America report are most useful in shaping these particular elimination strategies? And from this perspective, what is the country doing, and what is this general perspective, and how we can support this further? Dr. Mark, you have the floor. I hope you can hear us.
Good morning. Thank you for having me. I will try to be brief. So coming from a small island developing state, oftentimes based on the surveys that are sent from our partners, they're a bit taxing and time consuming. So one recommendation is that we use our surveillance system rather than these long surveys. Sometimes the information that's requested, we don't have it, or we don't have it in a form that we can actually present it to you where it makes sense. We are currently working on improving our health information systems. In fact, we've been using DHIS2 for about a year now for our surveillance, and we do have a regional training ongoing in Grenada, where we're building capacity on that front. And so we do have other health information systems, but they do not currently integrate, nor are they interoperable. So we would definitely need support from that aspect as well. In terms of information sharing, because we're small islands and our problems or issues oftentimes are the same, we share similar traits. So information sharing across regions, best practices, what works, what didn't work. And if we can find a way to tailor some of the international standards for elimination that can suit small island developing countries because of our makeup will also be helpful. And just to add a bit on something as basic as a Ministry of Health website that we currently do not have, support in that front will be helpful in terms of information sharing and putting all of the information that we do produce data from the Ministry of Health can be publicly available on that website. I think that's all I have. Over. Do let me know if you need any clarification or if I need to add any additional information.
This is great and very clear and very strong message that I think comes from that particular experience from Grenada, but that it's something that the Caribbean shares, and the need to strengthen our efforts to improve how we are making information systems a core element within the whole elimination initiative. And that's why also each of these different particular realities from the ground need to be also expressed in such an ambitious initiative such as the elimination initiative. Now let me go back and take some questions that we've been receiving from the audience and complement some of the comments already heard from our great panelists. And I'll start going back to Vice Minister Zambrano, who I thank, and the whole team in Panama, because I know you just had an earthquake a few minutes ago, and we still see you, and happy to see you well. So thank you, double thank you for being with us this morning and going through an earthquake with us. What are some of the elements that are key for Panama to accelerate this? So we talked before on how to align the initiative and how this has been an active work in the country, but what are the key now ingredients to generate this acceleration? And I'm linking to another question that we receive also from the audience on related to the role of the academia and collaborative groups that are seeking also to generate evidence to guide this elimination initiative. How can we bridge all these different actors and elements that can be used? Vice Minister Zambrano, thank you. You have the floor.
Muchas gracias.
Thank you so much. I want to send a greeting to everyone here. And when this report in the Americas, it gives key information to be able to help Panama speed up its efforts of elimination of diseases. And definitely, as it's been said before, the essential part that we consider is really hindering us is the technological aspects. We are even We just launched a national plan for health, military health, and this is really, we're really trying to merge the systems to have the right information to be able to take the corresponding decisions based on real facts and not hypothetical facts, and not believe a situation that at the end of the day, that's not what really happening. And the only way to do this is technology. And right now, in the immediacy of this information, to be able to make these right decisions and also focus on these situations, because definitely we have different scenarios depending on the general social or topographic conditions. So all of this, we consider that it's fundamental for to really advance, quickly advance. I think this is very, very important.
Obviously, the financial part is paramount. We need to be able to having our financial authority to start changing the paradigm of an expense to be seen as such and to think of it as an investment. It's something we need to move within, and I think it's somewhat easy where we are able to see how much these diseases are costing to be able to weigh it. We are able to tell how much this ill patient is costing to the government. So if we schedule this investment in time, we'll have savings. We have an actual profit. So all these concepts are the ones we need to start assessing by the developers of financial policies. We need to create awareness. I am absolutely convinced that when you're able to look into the expenses, you can't measure the Ministry of Health the way you measure others. We are paying that with debts. So this is a reality. And it's not the same as if you were thinking I'm building a road and trying to find fundings, and if a building broke or something to go fix it. If you don't have the money to supply the medications and the devices, the medical devices patients need, then we're talking about lives. So these are the scenarios where I believe we need to be working and bringing awareness to it.
Muchas gracias, viceministro. Clarísima la perspectiva también sobre cómo necesitamos.
Thank you very much, Deputy Ministry. We need to look into this and how to work with the prioritization in the country, not only in healthcare, but in the component of the availability of resources and multi-sectorial alignment to work together and to respond to many of these determinants and the technological component, of course. So in 1 minute, because we have exceeded the time we have for the panel, but I also want to hear from Dr. Cruz, Dr. Castañeda, and Mark about how to bring these services and these actions to bring them to vulnerable populations or that have difficult to access as a pillar that is mentioned in this report. And please take 1 minute, Dr. De Cruz, and all of you. Thank you. Thank you, Dr. Sebastian. I'm going to try to take 1 minute. Certainly, digital healthcare is a priority. In our government, we have created a department of digital healthcare, and we're applying technologies and bringing in applications, telehealth. So we're working with that. We already have it applied. And for malaria, we had a very robust program against malaria. And we're working now for the NCNC, with the applications for TB, applications for various diseases. And these are very important aspects. Also very quick, I'd like to tackle on what Dr. Adrian said about national protection. So we are investing into vaccines for estomosis, Hansen, and we've also implemented the ferroquine in schemes to treat malaria via Plasmodium. So we have been putting together a big training strategy, and we believe that's going to be a very important tool for the elimination of malaria. Thank you very much. Thank you very much, Doctor. I'm sorry to rush you this way, but now I move to Dr. Adriana Castillo as well. 1 minute, please. Okay, so additional to what's been mentioned in Panama and Brazil, I believe that being able to empower the community is very important. To have these community helpers in the territories that are the farthest territories, so people can have access to diagnosis and treatment, is going to be very valuable. Also, bearing in mind the difficulties that some territories do have to access technologies, to even access internet. We have regions where it's not that easy. So to strengthen community knowledge and everything that has to do with healthcare, education, prevention, promotion, and to be able to provide diagnosis and treatment in the territories, we believe it's one of the pillars that can be paramount to be able to achieve our targets and goals. Thank you, Dr. Castillo. And then finally, Dr. Mark from Grenada, a final message. Dr. Larissa.
Dr. Mark, any final comment? Yes, thank you. Sorry, apologies for putting you on the spot again. I know it's been difficult with the connection, but just any final reflection on what would be key to accelerate the initiative for Grenada and the Caribbean?
Well, I think from our perspective, it will be the information systems for health and ensuring that the standards are tailored to smaller countries so that the targets are achievable, because oftentimes the targets seem very far based on some of the indicators presented and how we go about actually applying for the elimination. So I think those two are paramount importance, and just assistance and technical support and information sharing on best practices, what works, what worked in some countries, what didn't work, so that we're able to learn from other person's mistakes and that our product can be improved as best as possible. Over.
Thank you so much to all our 4 brilliant panelists and for providing this perspective that we always seek. What is the reality from the ground, from the subnational even components, and how do we build this into our regional perspective as we move forward? So thank you all again. And now I give the floor back to Marta Saboya to lead us towards the end of this amazing webinar. Thank you, Marta.
Gracias, Sebastián, por la moderación de este panel.
Thank you, Sebastian, for the moderation of this panel. And moving toward the end of our agenda, I'm glad to invite Santiago Cornejo, who is the executive director of Revolving Funds for PAHO. And he's going to share with us a little bit about his perspective and the initiative of elimination and the critical components to accelerate the achievement of regional goals through the access of technologies in health. Santiago, welcome. Thank you, Martha. It's such a pleasure for us to be able to talk about the revolving funds of PAHO in the context of the initiative of elimination. These are mechanisms of cooperation created by the countries more than 40 years ago for the timely access to quality public health supplies and also at the best prices. It is important to highlight that these were created 40 years ago by countries to show innovation, because the PAHO funds are the only ones that exist. And now we see how other regions are trying to create similar mechanisms. These funds have two specific characteristics. The first one is the demand consolidation, that through the countries we're able to consolidate a demand to create scale economies, helping us get the best prices in the market. The second characteristic is a comprehensive approach given by PAHO. And these aren't only procurement mechanisms, but technical cooperation mechanisms. And they are linked to the cooperation of the various technical teams in PAHO, from the assessment of products quality to technical consultancy for the selection, decision-making, and planning of these products. And here, with the initiative of the elimination, this comprehensive approach gives us the capability to look into all the supplies needed for the elimination of diseases. And the PAHO revolving funds you can find from vaccines and supplies for vaccination to diagnostic kits and medical devices, either for medical treatments or supplies themselves for vector control. When us, as revolving funds, we're working with 42 countries and territories in the region, with, of course, the ministries of health, but not only the ministries of health. You also have other ministries also have access, other public institutions that are very important. And right now, sub-regional entities as well, because it's important that they have access to the acquisition of products. In the last years, about 180 million people were impacted by this. Like 224 million vaccines have been purchased, 15 million diagnostic kits and treatments, and this helps us achieve best prices. Like we've achieved a 20% of savings compared to prices access to outside from the region in countries with similar income, and also in antiretrovirals. So if we go specifically to other examples of supplies and the important initiative of elimination, like uterine cancer, which is an important priority for our region. In the diagnostic kits and HPVs, we have had savings of 40% as compared with other prices that are offered regionally. For the quadrivalent in HPV, also our prices are three times lower as compared to others that have mid or high income that are buying the same vaccine. For HIV, as I said, we have achieved great savings, like the annual treatment of HIV is costing $37, and for hepatitis C, the combination of fixed doses of generics, we can get it now for $60, and that has only been achieved by this demand consolidation. But we've been also able to bring something in, like hexavalent vaccine that helps prevent many eliminating diseases. We have gotten a hexavalent of full cell, whole cell hexavalent that eliminates the number of doses to be provided, while at the same time is being provided with very accessible prices. We've gotten great achievements, but if we want to speed up and progress in the initiative of elimination and to also respond to new things, we need to innovate and identify new strategies and priorities. The funds we have the next new priorities to be able to progress in this. One of them is to strengthen innovation in national production. We want to reduce dependency from our regions to essential healthcare products and reduce vulnerability to the supply chain. And in the months to come, we expect to be able to announce for this elimination strategy. Else in our region, we also want to establish the quick response kits for outbreaks that can give us that quick response in case we need any supply and early access to medical measures, which was one of the weaknesses during the COVID pandemic. We've also analyzed the creating of a regional warehouse, which is going to be very important, particularly in the initiative of elimination to reduce interruptions and costs of transportation. And lastly, I wanted to mention new technologies, to continue innovating and giving access to new technologies. And here I just want to mention, because much was said by the representatives from Panama and Colombia, all the representatives talking about telemedicine and telehealth, which are very important tools and can help us not only to increase access, but to create efficiencies in the services. The revolving funds, we have a byproduct for telemedicine, and the great advantage these products have. And we've already run this assessment that are compatible, interoperable, high quality, and accessible. So I wanted to wrap up with a call to continue asking countries to continue giving support to revolving funds and to consolidate the demand, because not only countries can find benefit, but also with the funds, they automatically provide benefit to all the region, because all the countries have a benefit from these products. So I want to invite everybody to visit the portfolio from our revolving funds, and we are at your service and at the service of all the countries in need us. Thank you very much.
Muchas gracias, Santiago.
Thank you, Santiago, for the information you provided. I'm certain that those watching this webinar today will most certainly be looking at the regional portfolio with so many news you've given and the potential in the cooperation mechanisms to speed the closing of these gaps. Thank you. And now to close, wrap up, I want to invite Dr. Silvan Aldigueri. He is the director of the Department in Prevention, Control, and Elimination of Diseases, and Dr. Sebastian Garcia, who moderated this panel this morning, so that they can give their wrapping up comments. Sebastian Silvano, thank you and welcome.
Muchísimas gracias, doctora Saboya.
Thank you, Dr. Saboya. It's been a true pleasure to share with all of you today during these sessions about the interface in the initiative and the analysis of accurate data, reporting of policies of healthcare for the elimination of 30 diseases by 2030. And I want to thank Dr. Alda Cruz, the Secretary of Health in Brazil, Dr. Castillo Castañeda, from the Ministry of Health in Colombia, Dr. Larissa Mark from Grenada, and most especially Dr. Zambrano, Deputy Minister of Health in Panama, with a specific attention to the impact in the western side of the country occurred by the earthquake, and we expect that no important damages are to mention right now. And I wanted to highlight a couple things fairly quick, emphasizing in some of the comments from the panel members. First, a comment from Pajo. One of the 4 pillars of the initiative of elimination is the strengthening of surveillance. So once again, we're talking about an interface with information and surveillance systems with accurate information for the availability of decision makers. But I also want to highlight the importance in the lab surveillance. We are living a time of the scientific history of the continent where we can access a lot more powerful tools. And so for instance, I'm talking about the integrated surveillance via serology and multiplex aspects, pre-elimination, and also for post-elimination surveillance. Something important to highlight here for Dr. Castillo is about the border, the elements of borders. And I'd like to point out multi-elements in the country, rather. And I'll tackle the elimination of the malaria, both in Central America as in the islands and the Spanish basins, and it's through coordination and harmonization of activities, including multi-country analysis of information, that we can help the countries during the last mile of the elimination of malaria. The elimination of malaria with a specific technical message, starting by Plasmodium falciparum malaria, which is the first enemy that we have right now. And real quick, a second point in equity to access healthcare services, but also cultural access. So it's not only geographic, and trying to highlight the importance of working with all control programs and the most integrated possible programs with cultural measures and approach of healthcare for Afro-descendant minorities in Latin America. So I want to thank this initiative again and the invitation to this webinar. And thank you all for your participation, you colleagues that are right here in the forefront. Thank you very much. Thank you, Silvani. What's left for me is to thank you all of you who made it possible, of course, to have this space that allow us to communicate in 4 languages in reality, our interpreters and all the team behind the operation, and the conducting of a report that is trying to provide an objective view to a history of more than 30 years in a region, and that is bringing challenges and opportunities ahead to advance together with the countries. One more tool for your availability from Bajo to the region, and that we expect are very useful and of great richness for the initiatives of elimination in our countries, particularly for our populations and our communities to have a better living. Okay, so thank you all very much. And Marta, back to you. Thank you, Sebastian, and thank you, Sivan, for your closing remarks. We are very grateful to our panelists in all the countries and our speakers and our main speaker and all the team from Bajo for your contributions in today's panel, and we wish you to have a wonderful rest of the day. Thank you and goodbye.